Hello everybody, this is Dr. D. I'm from Hazleton Eye Specialists. I'm here with my new friend. Here he is. This is Theodore. Stanley came in today because he was told at a local urgent care that he had an abrasion on his eye, and he was given some antibiotic eye drops to treat that. He's been using that for about how long now? How long were you using those eye drops?
Oh, a week at least.
About a week, and the pain did not go away. The irritation on his eye did not go away. The redness did not go away. And so his lovely daughter, who was just in here with us, recommended that he see an eye doctor. So we were happy to get him in today as an emergency patient. We're happy to let everybody know out there we do take emergencies, so give us a call whenever you do have an emergency with your eyes. So the reason we wanted to highlight this patient today and this experience that he was having was because this is something we see very often. So he was told he had a scratch on his eye, and with further investigation, I'm going to show you what we found. So what we did was we had him look up to the ceiling, and we put a dye in, and the dye was able to show us exactly the size and shape of the irritation he had on the front of his eye. So this is fluorescein dye. I'm going to have you look straight up to the ceiling for me, and we just place it there on the eye. Then what we're going to do is we're going to utilize our slit lamp, which unfortunately is not present at a lot of other healthcare facilities like emergency rooms and urgent cares. So this is what really allows us to be able to diagnose with real certainty what's going on the eye. So come on up here, put your chin here on the chin rest, forehead up against the top bar, look out at my right ear. And so here we can see, when we look at the eye, a very unique pattern, a very unique staining pattern. It's right in the center of the eye, which is a very dangerous place for any defect to be on the eye. And so what we see here is a very, very, very common picture that we see with the herpes simplex virus, or herpes simplex keratitis, the cold sore virus, actually, that can affect the eye. And so what I explained to him is that this is a virus that lives in all of us, and it's not uncommon that this virus can affect the eye. And it's not uncommon that this virus is misdiagnosed or mistreated as a corneal abrasion with an antibiotic, or even worse, a steroid, which can make it much worse, cause permanent scarring and vision loss.
I'm on steroids, by the way.
And he's actually on steroids. So what we're going to want to do is kind of retool his treatment regimen so we get him doing much better. But because of the location being right in the center of the eye, we're going to utilize a cutting-edge technology that we've described to him already, but I'm going to explain it to all of you. It's something called Prokera, which is an amniotic membrane, which is derived from the placenta, from a fetus, which is healing tissue, okay? It's healing tissue. It's not stem cells. It's connective tissue, which is pro-healing, anti-inflammatory. So I'm actually going to show you today our application of this Prokera onto this patient's eye, okay? So what we have here is the Prokera membrane. It's in this device here. So what we're going to do is we're going to wash out the solution that it is bathed in, which is a combination of a antibiotic and preservative solution. So we're going to wash that out. We're going to wash that out there, okay? And I'm going to get a glove or two. And I'm going to put in 1 drop of anesthetic, look up to the ceiling, and I did describe to him that, he may notice an awareness with the lens. It's probably not the most comfortable thing, but again, with the location of the defect on the eye, it is something we want to take care of with our most aggressive cutting-edge technology. So here is the membrane. It's a plastic ring, and the membrane is in the middle there. And so what we're going to do is, it's very simple, so come on over. What we're going to do is we're going to have you look down to the floor, lift the upper lid, look down to the floor. Good. And then we're just going to place the membrane up underneath the upper lid, have him look down, place the lower lid over the membrane, and have him just blink naturally. How was that? Was that okay?
Yep.
Didn't hurt, right?
No.
Putting that in was fine? Okay, good.
No.
Good. So he was a really good patient, and he was able to take that lens placed onto the eye really easily. Of course, he does have some anesthetic on now, so we do want to educate him that this is something that may cause some awareness. There are some different things that we can do. We can place a tape right here on the corner of the eye to keep that stabilized over the eye, give him an eye patch and tell him to just keep that eye closed. We are also going to give him a topical antiviral drop that he's going to be taking, and we're going to see him back in just a couple of days to observe to see how this was doing for him. So again, we're really proud to offer emergency eye care here at our office. We're proud to offer cutting-edge technologies in the form of Prokera or amniotic membranes. If you or a loved one think that you may be someone to take advantage or benefit of these things, give us a call, 570-453-2020. Have a good one.